Hello everyone and welcome to Dentistry. This video highlights some useful tips and tricks which can help you make a perfect dental impression every single time. The number one rule for a perfect impression is to make sure that the impression surface intraorally is completely free of saliva or blood or any kind of moisture. This is necessary to have an impression which is free of voids and bubbles. So dry out the impression surface using suction, cotton rolls or your 3-way syringe and then go ahead with the impression procedure. Same applies for a crown and bridge impression. Keeping the margins free of blood and saliva is necessary for an accurate impression. If the prepared area is bleeding profusely, you can use hemostatic agents, gingival retraction cords, retraction pastes, or a combination of any of those to control the bleeding and saliva and ensure the margins remain visible and dry. Try the tray inside a patient's mouth prior to loading the impression material. Do not skip this step as a lot of mistakes happen when your tray size is either too large or too small and you end up repeating the impression. Two things to consider when you're selecting your tray. 1. Make sure that there is at least 3 to 4 mm of space between your tray and your teeth. This space is necessary to accommodate your impression material. 2. Make sure that your tray does not touch the teeth or soft tissues, or sometimes you have bony protuberances also. If that happens, your tray is probably small in size and you may want a larger tray. Also, tray selection gives the patient a practice round so that he or she knows what to expect when the actual impression is taken. The mix should be smooth and homogeneous. In case of alginate, it should not be grainy or too runny. Instead, it should be thick enough to hold itself on the impression tray. So, master the art of impression manipulation, as the correct consistency of the material is extremely important for a good impression. A very common mistake that I have seen is that the tray is overloaded with the impression material. When this happens, you end up getting your tray placement wrong and also making the patient extremely uncomfortable, which could induce gagging. And inevitably, you have to repeat the impression. So be mindful of the amount of impression material that you are loading onto the tray. When taking the impression, for the upper arch, stand behind the patient, and for the lower arch, stand in front of the patient. The patient can be seated in an upright position as this is more comfortable for the patient and it prevents the gag reflex. Retract one side of the cheek with a mirror or your finger for easy placement of the tray. Make sure that the material is completely set before taking it out. Do not move the tray while the material is setting. This can cause the material to smear or have bubbles or drags. Read the manufacturer's instructions for the material setting and working time. After you place the tray in the patient's mouth, make sure you don't push the tray too hard that it touches the patient's teeth. If this happens, you will see the exposed tray through the impression, and if you pour the impression, the resulting model will be distorted and you will have to repeat that impression. Also, make sure that the patient doesn't bite down on the tray. Be conscious of the patient's tendency to gag. Again, I would like to remind, do not overload the impression tray with the material because an excess is what triggers the gag reflex. Try using the least amount of material possible. Have your patients sit up straight on the dental chair. Ask them to look towards their feet to lessen the feeling that the material is trickling down the throat. Also, have the patient focus on their breathing through their nose. Try some distraction techniques like lifting a leg or wiggling their toes during the impression. A combination of all these techniques will limit the chances of patient having a gag reflex. Thank you for your time, and I hope this video has helped you with some useful tips and tricks related to dental impressions.